stands for abdominal aortic aneurysm. It's a life-threatening problem. And unfortunately, a person does not know that they have an abdominal aortic aneurysm. There's no symptoms associated with the problem. It's a ballooning of your blood vessel. It can happen in your chest or in your abdomen. It can happen in your legs, in your arms. There are definitely risk factors. A lot of it is genetic. So people who have a family history with their father or mother or grandmother, siblings, having an abdominal aortic aneurysm have a higher chance of having an abdominal aortic aneurysm. People who have a history of smoking definitely have an increased risk for developing an abdominal aortic aneurysm. And age is a big factor. Being a male also makes you much more likely, 4 times more likely, to have an abdominal aortic aneurysm. The abdominal aortic aneurysm refers specifically to the ballooning of the aorta in the abdomen, and that's the most common site for the aneurysm to form. When the symptoms occur, meaning that bubble bursts, the risk for a person to die is astronomically high. And unfortunately, most of those people don't make it to the hospital. The idea that we have tried to promote here at the San Diego Vascular Center is to be able to screen a person to see if they have an abdominal aortic aneurysm. Since there's no symptoms, the only way you can pick it up is by doing an ultrasound. The ultrasound takes a picture of your stomach. And if the aneurysm is seen on the ultrasound, then you can fix the aneurysm before it ruptures. There's probably 2 million people in the United States who have abdominal aortic aneurysm. And it's the 13th leading cause of death in the United States. The reason the prevalence of the disease is so high and the incidence of death is so high is because, again, the person doesn't know that they have it. So unless you have the ability to pick it up early by a screening program, we as a medical society don't have a better way of addressing the problem. Today, our ability to treat the aneurysm is amazingly good. And therefore, it makes all the sense in the world to try to find these patients who have a life-threatening problem earlier.